I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
That was January 2020. By then, nearly 200 people had died in China. Thousands were infected. Makeshift hospitals pop up to keep up, and China's viral epicenter, Wuhan, is sealed off from the rest of the country. Days later, several countries announce they're barring entry of foreign travelers who were recently in China. The Philippines records the first COVID-19 death outside of China, while off the coast of Japan, 700 passengers aboard the Diamond Princess cruise line test positive. The ship is quarantined for nearly a month. By mid-February, France reports the first COVID-19 death in Europe, and South Korea suspects a super spreader event is linked to a church congregation. Iran and Italy emerge as new epicenters. Lombardy and Veneto in the Italian north are sealed off. In early March, dozens test positive on a cruise ship docked off the coast of San Francisco. America unsure whether to let them disembark. A week later, the World Health Organization officially declares a pandemic, and the U.S. declares a national emergency and takes action.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days.
The entry ban lasts much longer. Overseas, air passengers scramble, while in the U.S., panic shopping takes hold. China announces 0 new local infections. Life there starts getting back to normal. But for the first time ever, the Olympic Committee postpones the world's largest sporting competition to 2021.
These Olympic Games can and will be, at the end, a celebration of humankind having overcome this unprecedented challenge of the coronavirus.
In Europe, Italy's death toll overtakes China. Russia records its first death. Global travel grinds to a halt as the virus spreads to 170 countries. Around the world, social distancing becomes a common practice. It's a challenge in overcrowded, impoverished communities. Wearing masks, the new norm. In some places, it's obligatory. Liberté! 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 But the precaution is politicized.
The mask is a confinement. It is an interposition between you and me in the exchange of communication.
Several nations introduce lockdowns, including the UK. Balconies become a new stage. Early April, the British Prime Minister Boris Johnson is hospitalized with persistent symptoms. He's discharged a week later.
The NHS has saved my life, no question.
Johnson says it could have gone either way. The Big Apple becomes a ghost town as case counts soar, hospitals fill up, and New Yorkers are told to stay home. In Washington, President Donald Trump announces he'll suspend American funding to the World Health Organization, charging mismanagement. At home, his critics accuse him of mismanagement. Unemployment surges. Trump reveals he's taking an anti-malarial drug to prevent catching COVID-19, despite warnings from doctors against it. The U.S. becomes the global epicenter of the virus. Makeshift morgues in Manhattan, mass graves dug nearby. New Zealand lifts most restrictions in early June, but the island nation remains shut to foreign arrivals. In July, India overtakes Russia as the world's third biggest hotspot. It lags behind the US and Brazil, their leaders both subsequently testing positive for COVID-19. By August, cases in Africa top 1 million. Around half are in South Africa. Russia approves the vaccine before its trials are completed. China starts inoculating healthcare workers with one of its vaccines, still being tested at home and abroad. September brings a second surge in cases to Europe. By the month's end, global deaths top 1 million. An outbreak in Washington is tied to a White House event. Dozens are infected. November, parts of Western Europe reintroduce tough restrictions. And America's next president issues this warning.
We're still facing a very dark winter.
A month later, in record speed, regulators in the UK, Canada, and the US authorize emergency use of a vaccine. Widespread inoculations begin. While at the National Cathedral in Washington, The bell tolls 300 times, remembering America's 300,000 dead. Roee Ruttenberg, CGTN,